Sickle cell disease is a group of blood disorders passed on from parents to children. It affects thousands of people worldwide, and tomorrow is World Sickle Cell Day. So we've invited National Coordinator from the Caribbean Institute for Health Research, Jennifer Knight-Madden, to share with us the plans for this day. Good morning,
Good
Jennifer.
morning.
Morning. Thank you so much for having me on the program.
How are you?
All right,
I'm very well, thank you.
I did say at the top that it's a group of blood disorders, but clarify for us and for our viewers, what is sickle cell?
Sickle cell disease is a blood disorder and it is inherited from parents. So each parent gives a gene that is abnormal to the child. At least one of these genes must be a sickle gene. And what happens with the sickle gene is that the red cell, instead of being round, it tends to become sickle shaped or banana shaped. And these sickle cells are much more stiff and they don't do very well and they're not as efficient in taking oxygen around the body. As a result, all organs in the body can be affected by sickle cell disease, but it is very variable.
Does that mean that if my mother or my father has it, I am certain to have it or not necessarily?
No, absolutely not. Very good question. So, if both parents have a trait, that means they have no symptoms. They're perfectly well. And if they don't do a test, they won't even know that they have a trait. So, first thing, everybody needs to know their own situation by doing a blood test. If you've had a baby in Jamaica, you would have been tested so you can check your antenatal card. Then, if both parents have a trait, each pregnancy, the baby has a 1 in 4 chance of having sickle cell disease. If, however, one parent has sickle cell disease and the other one has a trait, then it's a 50-50 chance. So, in all, 15% of us Jamaican adults have a trait, 10% sickle, 5% another one. And that leads to 1 in every 150 babies born in Jamaica actually having the disease, sickle cell disease.
Right. I'm guessing it can't be cured. How is it
Yeah.
managed? Can it be cured?
Well, it can be cured.
Oh, nice.
Um, yes, it has been cured for some years using a bone marrow transplant, which is you take blood from bone marrow from one person, you essentially kill off the bone marrow in the patient and give them that bone marrow.
Okay.
That's very expensive, and also you need a donor, and it's not done here, and it's difficult to get done. We're actually now doing a trial research where you actually are your own donor. So we take your bone marrow and we put in a healthy gene and give it back to you. And if it works, you are cured. And
Wow.
we're participating with our colleagues in Cincinnati and Aravan, and it's going well. We've done a couple of people. The results are published, and we're looking forward to doing some more.
Wow, that's
So, but for
heartening to
the
hear.
absolutely,
Yeah.
but for the vast majority of people, it's about management.
Yeah.
So the most important thing is newborn screening, and the government actually has recruited every hospital in Jamaica now to test the babies at birth because your highest risk of premature unnecessary death is actually in the first 5 years of life.
Right.
So if you're tested as a newborn, you can start treatment as early as 2 months, and that treatment provided by the government, relatively inexpensive, allows you to have less problems and it prevents some needless deaths.
Yeah.
So after the newborn period, there's also medication that's available, such as hydroxyurea, which can help to decrease complications. But otherwise, the most important thing is knowledge.
Yeah.
Knowledge.
If
You're
if
coming to clinic.
yeah, if what you just said, so if for whatever reason my child is not tested at birth,
Right?
how do I know that my child has it, and how soon would I know?
Okay, so if you have a passport from the Ministry of Health, the same one that has the immunizations, there's actually a spot for the nurse to tick off whether or not the test has been done. So the first thing is to check there. If it's not ticked off, then you need to get a test done. In the past, we've only alerted people who have the disease to bring in their children, but we're moving towards where everybody would get a result. That's in process. But children with sickle cell can present as early as 4 months of age, and then you have people who wander in their 50s because their gallbladder is big, and they have some symptoms, and they're found to have sickle cell disease. It's very variable, but you could go to any healthcare provider and get a sickle cell disease test, and then you would know for sure. So all of us as Jamaicans should know our status, the status of our partner or potential partner, and our children's status.
Yeah, we've come a
This
long
year,
way, Jennifer, because there was a time when people would hear that, your child has sickle cell, and they would think almost, wow, this is going to be the end. But I think research and developments have brought it to a level where management has pretty much allowed people with sickle cell to enjoy a healthy life.
absolutely. And the more knowledge you have, so the more things you can prevent and take care of them early, the better it is. So this year, our theme is the sickle cell community protected and proud in COVID, in a time of COVID-19. And in terms of protection, one of the things we're doing is a lot of our visits are actually being done remotely. So we're having that conversation, taking the history. If there is need for the patient to come in, then we arrange that. But we're actually probably seeing them every other time using telemedicine so that they have less exposure. We're also protecting them because the Ministry of Health is making another critical vaccine, the pneumovax, against this really bad bug called pneumococcus, available to sickle cell patients for free. So that's a big step in protection. And proud, well, that's what we're doing here today. We're against stigma against people with sickle cell disease. So, if that's a whole nother story in itself, but many people with sickle cell disease do suffer stigma,
Yeah.
whether it's because of jaundice or other complications. So I invite you and all Jamaicans to join with us to big them up and to be against.
I was going to ask you that also. Is there a physical look? Can I just look at somebody and say, what happens to the body? I mean, is there something that
All
physically
right.
goes wrong?
Good question. So the typical look, the stereotypical look is tall and thin. And that is because the blood cells in people who are not affected last about 4 months. But in sickle cell, the blood cell might last only a couple of weeks. So the body spends a lot of energy making new blood cells all the time. And despite that, there is an anemia. And they often don't gain weight well. So the typical look is thin and relatively tall. But we have patients of every single size and description. But it is not unusual for people with sickle cell disease to have jaundice, so the eyes can be yellow. No, in general, if you are out in public and you see somebody with yellow eyes, you kind of dress back because you think, oh, is this jaundice due to hepatitis? Is it catching? Whatever. But the sickle cell disease is not catching. You only get it from your parents, so that you can't catch their jaundice.
Yeah.
Sometimes they also get leg ulcers, and you see them with the ulcer wrap, and that can last for months, years. And so, for these kinds of reasons, sometimes they suffer from this kind of stigma.
Delia used the word managing sickle cell earlier. And you hear lifestyle diseases, they say you have to exercise and you this and you that. Does exercise help in this case? Does it hurt? And if the answer is yes, it does help, what kind of exercises are we talking about?
Well, you have some great questions.
Oh, thank you.
Because exercise can be a trigger for pain in people with sickle cell disease. They easily become dehydrated, and that leads to pain. So in fact, we have to send our children to school with a letter that says they tell you how much they can exercise, because individuals know if I go past this, then I might go on to a painful crisis. So some of our children, they could do any exercise. Others can't do PE at all. So it's very variable. What is important is a healthy diet, not taking iron tablets because it won't make the anemia go away, and keeping well checks at your clinic so that you're up to date. Because what we do at the clinic visits is to tell you what to look out for next. So we're not gonna, say to this poor parent everything that's gonna happen or could happen with sickle cell, but we'll say, okay, your baby is 2. So we're looking out for the spleen problem still and the swelling of the hands and the feet. Okay, your child is 7, so they're going to school. So at school, they're going to have to use the bathroom more frequently and drink more water. So you need to have, and the Sickle Cell Support Foundation has actually produced a book which has been sent out to all schools so they know how to manage children with sickle cell disease. You're now an adult, you're 20. Say, yes, you're feeling fine, but you know what? This is when kidney disease starts. So even though you're feeling fine, let's do these tests and look out for it.
Yeah, Ms. Jen, we got the wrap-up signal. I have to jump in. In this case, a healthy diet means what in this case? Are there things that we should not be eating if we're sicklers, and are there things that we should be eating? You said don't take iron tablets. What else we should be aware of?
The same typical healthy diet that you learn in grade 5 and grade 6, where you eat lots of fruits and vegetables of different colors. You eat your proteins, your starches, and a little bit of fat. It's the same thing. It's just that, you have anemia, but it's not iron deficiency. So don't go taking additional iron.
Yep. Final question quickly. What happens tomorrow?
So tomorrow we have a webinar, a global sickle cell disease webinar that is at 7 o'clock in the morning. This is being put on by the Global Alliance of Sickle Cell Disease Organizations. I'll be representing the Caribbean, and there'll also be people from Africa, India, Europe, North America, and so on. We'll be putting out the Ministry of Health. When I say we, I mean the Sickle Cell Technical Working Group led by the ministry. We'll be putting out advertorials in the papers so that people can read and learn about it. We'll be having social media posts, and we'll be having some other spots. So please be alert and look out. And if you know somebody who has sickle cell disease, please support them. And if you don't know your own status, please find out.
Well, Ms. Jen, obviously you're very, very, very knowledgeable, and we were quite informed this morning. Thank you so much.
I get quite a
kick.
Yeah. There you go.
Thank you.
Jennifer Knight-Madden, National Coordinator from the Caribbean Institute for Health Research.
All right. Up next.
Delia alone that.
Are you the do-it-yourself type?
Delia and Clive.
We're going to share some fancy gift card ideas that you might just find useful.
Delia and Clive. Oh, we're not making anything?
No, we're just going to tell him.
Oh, good. But we are making. Clive said we're making, so Clive is going to be sitting right here.
Come,
Clive. Soon come back.
Mercy